bit there.
Right.
Sounds a little bit like him there.
Right, yeah. So,
and I know you had many hats over here last several months, so appreciate you.
Is it kennel cough? Is that what
Kennel
dogs
cough,
get?
yeah, that's what I have.
That's what you.
That's what I have.
That's what you
Chronic
get.
kennel. Actually, mine is chronic allergies. It's even though I don't smoke, I kind of have that chronic smoker's cough from just animals, and I'm allergic.
Sure.
You know, I'm the veterinarian, allergic to dogs, cats,
Pet
horses,
dander.
cows, and
Yeah.
that stuff. So
Right, yeah.
I developed it in vet school and just stuck with me all the way last. Gosh, it's been 26, 28 years ago now.
Wow.
Anyway, welcome, Muscatine area. This is Dr. Dan, the Animal Man. And 263-8600 is the phone/text line if you have any questions. We've had a few good ones over the past. And I was trying to think, or yesterday, today, what do I talk about today? Because if you're a regular listener, you've been waiting for the old, what do we do with the new pet birds and squirrels and rabbits and stuff we find outside. But it's still not spring yet. So I'm going to hold that off for another visit until it gets warm out and we start seeing those actual furry outside feathered and non-feathered critters that we have to deal with. So we'll delay that for one more visit here, and then it dawned on me. I've had several inquiries, a couple of casualty cases and stuff dealing with just routine neutering and spaying your animals and that routine health care. Because last time we talked about some of the routine health, vaccinations, and this is the time of the year that we do a heartworm test and Lyme vaccinations and lepto vaccinations, and then I had a guinea pig I neutered since last time I was here, and that's actually the first time I've ever neutered a guinea pig, and I started thinking, what, about every 6 months I should talk about the old spay and neuter, and if you have any questions about should I, what age, when, should I breed, should I not breed, that sort of stuff. So I thought I'd just kind of roll back to the standard, Bob Barker message as far as spaying and neutering your animal. And but there's been some research, and it seems like in the vet field, the age of when we want to spay and neuter them has kind of gone and changed, and new research showing out there. And I would probably say 2.5, maybe 3 years ago, there was a study that came out in some of these larger breed dogs. You talk about your golden retrievers, your Labradors, your Newfies, and those larger breed dogs that tend to have hip dysplasia. Mm-hmm. If you have a bigger dog, you've probably heard of hip dysplasia. They get that arthritis in the hip, and maybe even some knee problems in those dogs with ACLs.
I got that same thing.
You got hip? What?
I got
sign
hip
you up.
dysplasia.
We'll get a surgery taken care of for you there.
I don't want a surgery. Got any meds I can take?
Yeah,
Okay.
well, they may make you bark.
I don't care.
Or go pee on hydrants when you're
Well,
done.
no, I'd bow out of that one. Yeah.
That's why I brought the guitar. I'll talk about that in a bit.
All right.
But what they've shown is if we can wait and hold off, because we used to like to spay and neuter them, especially those male dogs, neuter them before they reach that puberty, 5, 6 months of age, because they start getting behavior issues.
Oh.
And we want to knock that in the, knock it off before it starts happening.
Nip it in the bud.
Nip it in the bud. Nip it
That's
in
what
the
Barney Fife
noogies.
used to say.
Nip the noogies to nip it in the bug.
Right.
But and now the research is showing that if we let them have that first, puberty, let those testicles, let that estrogen kind of kick in a little bit, they have a little bit sounder bone growth in those hips and knees.
Oh, okay.
So now we have a dilemma with our recommendations where we have to give them, okay, here's the Kobayashi Maru,
Right.
Peter or Paul, which one do you want?
It's like a scale.
Yeah,
Right.
What's your priority here as an owner? Are you more worried about health issues and hip and arthritis issues, or are you worried about behavior issues? Mm-hmm. So, granted, health issues, we prefer to wait till they're about a year, 10 months old, let them have that little age on them before we spay and neuter them now. That's what the research shows. However, we know that if we let them have that first heat cycle, their chances of mammary gland tumors go up a little bit. So, do we want to have mammary gland breast cancer, or do we want to have hips? It's a little bit difficult, but because of the research, you can't have them both.
Now, I was heard when I was a kid for a female dog that if you got the female fixed, that it was a more loving dog. Is there any truth?
There is truth. There is some truth. Not every dog fits in the same groove, so that's actually a very good question. Female dogs, as well as even especially the male dogs, and so female dogs, they start getting that heat cycle estrogen. They can develop behaviors protective. The estrogen that and we've seen plenty of mother dogs, the bitches that have had whelped, that have had a litter, and then they're just personality changes. They suddenly become protective. Now that's not all of them, but some of them are just perfectly happy if they bonded to humans. But some of them will get a little bit of a temperament when that happens. Of course, you prevent that hormonal interaction of influencing their behavior.
Now, can that same protection transcend into their protecting their human pack?
All those different things can happen. There's not a cookie cutter on that, but I don't think there's any research that shows now they're going to protect you versus protecting the puppy. I don't know that there's any research on that.
But dogs are pack animals, and we are their pack.
Yeah,
right.
It depends on. A lot of that depends on the nurture. Nature versus nurture.
Sure.
And there's your nature. Now it depends on how they were nurtured within that family and the owners, if that's going to transcend. So there's why there's the variable comes in. They can have that, but if maybe they're a good example, or the breeding animal that doesn't have that bonding with humans, they'll probably more have a different reaction than if they had a family with kids and do that.
I have a question about the nature part of it, because this is always some people call me a dog whisperer when I get around their dogs.
I've heard you say that before.
But I have seen different characteristics that transcend all dog species. The number one thing that I see is dogs walk around in a circle before they lay down in something. Now that's nature. That's inbred
something
in there.
And I don't even know why. I've never taken the behavior class.
I don't think anybody knows why, but it's in all canines. Most of them do it.
And I partly makes me wonder if they're like checking to make sure there's no defensive area.
The thought is that it goes back, in their genealogy, like they're making sure there's no snakes or no anything there to bite them, so they kind of walk around
the perimeter
in a circle, Make sure there's nothing in that bed that's going to bite them when they lay down.
And I heard in Australia they walk the other direction.
That's a good one, Doc. I'll give you 1 point on the wall for that one. One for the doctor.
Couldn't resist. I'm quick that way sometimes.
Good deal.
Anyway,
sorry to interrupt.
No, but we are talking a good point when it's nature versus nurture, and the male dog is even more a good example, or more of an example of that, where nature says, okay, I'm a stallion, I have testosterone, I need to fight off other males for the pack, I need to defend, I need to be. So it's more happens when I talk about females. You asked about males. Definitely we see that, where they're more apt to roam, establishing that territory if they have testosterone, if they're intact. So there's a definite proven on that. Just look at your horses, a stallion versus a gelding. Who's going to be more of a pleasure bonded to the family? The one that doesn't have the nature part, which is the testosterone part. So that's where in the male dogs, if we have them neutered before they start getting the influence of testosterone on their behaviors, we can prevent some of those marking the territory, roaming, aggressive toward other animals, aggressive maybe toward people and stuff like that. And again, like I said, now a couple of years ago we came up with the research that says, but then we take away a little bit from some of their arthritis potentials and their hip development and their knee development. So which one do you go with?
That's interesting.
So it's tough. And so we talk to the owners, and our standard at Riverside is, we recommend a year of age, right after that puberty, 10 to 12 months of age. However, we give them the whole information. And yes, we do have some owners that say, I have kids in the house, I got a female dog, I got whatever, and they're starting to see some of those behaviors that I'll sing about shortly, and they just want to have it done and take a little bit of that risk of some arthritis down the road just to have a better behaved animal down the road.
Sure.
At one time, and this has been many years ago, I don't know what the research is now, but I'm going back 15 years ago, they said 70 to 80% of the dogs that are hit by a car are intact male dogs.
Wow.
You got intact, neutered, you got females and intact females, so you got 4 options out there, but intact males are the ones that are roaming, smelling the female in heat way down the road, and then they're going to be out and jumping the fence, and next thing you know, a SUV hits them, and then we veterinarians try to put the pieces back together if it's a serious one.
Well, because they get that one-track mind and they don't even look for cars or anything. They're just, they're on the hunt there, and so that would make sense.
And some of them, especially the ones that are mostly in the yard, don't know maybe they go for walks but don't know what a highway is compared to
Sure.
a city street or something like that, and they can get that smell of the female and heat 5 miles away. Get a coonhound, you can probably go 10 miles away, they can sniff them out.
Right.
So intact animal will go hunting for those potential breeding females, and that's again, you talk about nature, and that's all hormonal driven. Now, that being said, there is a decent chance if we start seeing that behavior, and still, when we neuter them at a year of age, some of that should go away. Again, every dog is different. There's no guarantees, but one thing I can guarantee, it won't unless we try. So we have some of those things that we have to deal with is, what if and the potentials. And not all dogs read the book.
Right.
That's what we say too.
Right.
We'll do this, doc. Well, chances are yes, but not all dogs read that book, so they don't all follow what we recommend, but most of them will. And another health issue that we have with male dogs, we talk about after the fact. In fact, you know what I might do? It's time we could take a little break, and I'll get my guitar on, and then I'll sing a song, and I'll tell you some of the things that happen as they age with intact and males and females. We'll take a break.
All right, here we go. We'll be right back with more Dr. Dan, the Animal Man, in a couple of minutes. This is KWPC. We are the voice of Muscatine.
And we are.
And they used to call you the master of the Stratocaster, but now...
I don't know. It's Epiphone.
Didn't they? Back in the day? No.
Let's see, what rhymes with Epiphone there? The Deftone playing the Epiphone.
So now you've switched to acoustic.
Yep.
Yeah.
Well, I have that album, Dr. Dan Unplugged, and it's apropos.
Where can they pick that up at? Is that on
Oh,
iTunes?
I just
or?
have a few hanging around.
Okay.
I think there's one here at the station, and I have a
Okay.
few floating around. I print one off every once in a while. But it's apropos that the old "Who Let the Dogs Out" is the entrance song, and it's all about not letting your dogs get out.
Right.
That's what we were
Right.
talking about. And this song is actually one of the first few I wrote way back when I was on 2001 when I first started this radio show, and it's my, again, like I said, my Bob Barker tribute to spaying and neuter your dog. And now, as I sing the song, realize it's your dog singing it, not Dr. Dan singing it.
Right.
So this is coming from your dog's point of view. Okay. I'm a puppy and I'm 6 months old. I'm reaching puberty, so I've been told. The hormones are raging, that's a fact. It starts to change the way I act. Some call it neuter and others a spay. I think it's time to take it away. Take it away. Take it away. I've got a new hobby. I like to hump your grandma's knee. And my owners, they have found the wall turns yellow after I've been around. I'm getting bad habits day by day. I think it's time to take it away. Take it away. Bad dog, take it away. Now I'm roaming down the street, looking for that dog in heat. Is that a headlight shining in my eye? I kissed a bumper from a four-wheel drive. A hit by a car earns a hospital stay. I think it's time to take it away. Take it away. Get him neutered. Take it away. I say you gotta get me neutered. You gotta get me spayed. If you don't do it to me, I will never behave. Okay, that was the male doggers. They have to have a verse for lady dogs, right? They have their own unique problem I haven't talked about yet. So here we go. My owner, they told me, I think you'll have a litter or three. The next thing you know, 10 years go by, and now I got a pus-filled room inside. The doctor says you're lucky if you live the day. We got to do surgery to take that infection away. It's called a pyometra. Yuck, take it away. It's life-threatening. Well, now you heard from Dr. Dan. The things are getting way, way out of hand. We've got pet population is gonna bust if we don't take out that uterus. They make much better pets that way. The responsible thing is to get them spayed. Take it away. Just like Bob Barker says, to get them spayed and neutered. Take it away. Take it away.
Dr. Dan, the Animal Man, and what's the name of that one, Doc?
That's Take It Away.
Take it away.
As you would think.
Yeah, just take it away.
Take it away.
How do you come up with those, Doc?
I'm strange.
Yeah.
That's all I can say. A unique kind of strange.
Do you just, in the office, do you just say, just a line comes to you and you're like, I better write that down real quick?
It happens
or-
sometimes. In fact,
Yeah.
the first song I ever came up with called Pancreatitis Blues.
I remember that one.
Yeah.
I remember you singing that on the Ron Edwin
Yep,
show.
yep.
Yeah.
I came
I
up
have
with
a
that
cassette of that, I think. Yeah.
when I was bored during a homily at church. It just came to me.
I see.
So as soon as I got out of church, I quick wrote stuff down and
Right.
put it to finish the lyrics, and I come up with a few things like that. Some I steal lyrics from existing songs, just change them, like Weird Al Yankovic and some like that one,
Right.
all on my own. So I have a mix of everything. But anyway, it brings up the point of the female dogs when I'm talking about health. By the way, 263-8600, any question, does not have to be about neutering or spaying your animal or whatever animal you may
There's that
have.
kennel cough again.
That's that kennel cough, you know.
Mhm.
I have a little bit of that sleep apnea and when I wake up and dry throat, and this was one of those mornings.
I see.
It's lingering.
Right.
Anyway, so it's not contagious. It
Thank
just
God.
sounds like it. I've been vaccinated for
Yeah,
it.
I'm putting up my.
Is there a sleep apnea vaccine? A snoring vaccine. Oh, that would be a good one.
That would be a good one. Yeah.
Actually, anyway, we can do surgeries on that too with dogs. But so as they get older, and then we have that intact male and intact female dog, are some disease things. Now we talked about behavior earlier.
Mhm.
Now I'm going to talk about what happens as they get older and they have a uterus inside, like the song, or even the male dogs, which I didn't sing about as they get older. But female dogs, if they go through progressive heat cycles and never have litters, that endometrium, the uterus, fills up with nice secretions, like they're waiting for little puppies to come down, and nothing ever happens. And then 6 months later, it goes through it again, and they keep going through the cycle. And eventually, all it takes is little bacteria to get through there, and they now have an infection in the uterus.
Is that
Endometritis? Endometrium is the uterus. Pyometra is the disease.
Okay.
So we tend to see that with older dogs.
Endometriosis is a thing
pretty close
that
for humans.
Female.
Yep, and it's the same thing.
Yeah.
Only when you get itis, endometriosis is a condition of, itis is an infection of.
I see.
So there's same difference. Now you add pus, add infection into that,
Sure.
and it's endometritis versus endometriosis.
Okay.
Good. I'm glad you got science lessons today. That's Dr. Dan the Animal Man.
There you go.
It's a condition of endometrium is what endometriosis is.
Right.
So that's life-threatening. You know, you can imagine a big pus-filled wound inside, like my song. That's exactly what's going on.
Can you go septic from something like
Absolutely. In fact, that's what they die from, septics.
that? Okay.
And they start drinking more, they get sick, their white cell count is way high, and I've never seen one actually burst. That can potentially happen. It's got to be pretty rare for that to happen.
So do you do a blood test and look at those white cells, or how do you?
We do that
determine
first,
that?
then we do an X-ray and see this big, huge uterus in there.
Okay.
High white cell count, big uterus. Then we say it's not, now it's a spay, only it's an emergency spay.
I see.
And a spay is the lamest term for ovariohysterectomy. So we're doing that hysterectomy, taking out the ovaries to stop those hormones from causing the behavior and those issues. So it's a ovariohysterectomy. That's what spay is. So on those pyometras with the infection, we're taking out, again, that same pus-filled womb that's inside there.
So
And
let's talk about this, doing this way ahead of time, because
Prevention.
if you're in that emergency situation, that's going to cost you more bucks.
a lot more bucks and a lot more life-threatening.
To do that, yeah. Where you could have made just a regular appointment with you years ago and got it taken care of for very little compared to this cost.
Absolutely. And when it's worse than the cost of the life of your pet. And you know that happens.
Sure.
It's happened recently. So we'd rather prevent anything instead of deal with the repercussions down the road.
Emergency. Right.
Exactly. And of course, the other thing is, so you say, well, all I'll do is to prevent that is to get them bred. Well, then you have unwanted puppies, and there's a C-section potential, and so the best thing, and I always tell people, what do you want in your dog, and do you want a pet, a family member, somebody bonded to you, somebody that's going to live a long, long time, or do you want a breeding animal that could have behavior problems, have health issues down the road?
Mm-hmm.
And so you need to make that decision as a young animal when you have that. And I get a little bit frustrated is the wrong word, but I feel bad for the owners when I get this enough where they get a new dog and they got it for the kids, and you can see the kids, and hey, it's our little puppy, and I ask them, what's your plans down the road? Do you plan to have spayed or neutered? And they say, well, we have a neighbor that also has a Labrador, and they want puppies, so we thought we wouldn't spay it so they could have some puppies. I'm like, wait a minute, time out. You got this dog for you.
Mm-hmm.
Did you get it for your neighbor to be selfish and use your male or use your female to get puppies? Or what'd you get it for? A family, for those young kids you have in here. So you need to set what's your goal for that animal down the road.
And don't you really need some type of training if you're going to breed dogs? I mean, you just can't do that scenario like you said, because the outcome is not going to be good most of the time, right?
It's very difficult. People think just because I have, and some can do it, don't get me wrong. I'm just saying the vast majority. I have a dog, it's female. It's a great dog. We should get some puppies. Think about that, hard. One, there's a lot of expense more than you realize, so you're not going to make money on it.
Mm-hmm.
If you do things right, you're not going to make money on it because you have the vaccinations, the puppies. What if you have a C-section? You need to put, several hundreds of dollars away for that. And then you got to find homes for that. And I'll tell you, I work with the Humane Society. I'm going to talk about them in a second all the time.
Mm-hmm.
And just 2 weekends ago, we spayed and neutered 20 animals to get them adopted at the Vet Tech program. And there's plenty of good, and they're great animals. There's plenty of them out there. So one is a population control, and two is Are you really, do you know what you're getting into as far as finances, like you said?
Mm-hmm.
And do you know what you're doing for health purposes? Is that a really good dog? Have you had it checked for hip dysplasia? Do you know if it's got good knees? Does it have a good heart? Does it have a good body?
Right.
Are you getting
a
a heart
battery
prevention?
Of tests that you need. Right?
Yeah, to make sure it really is. It may be a nice personality, but it really is good genetics to be passing on down the road.
Sure.
Collapsing trachea, would make them cough. A lot of things that go into making sure it's a good product, that's going to be a good pet for down the road. And the same thing with the male dogs. The health with the male dogs is as they get older, they can get prostate problems.
I see.
Being on prostatic hyperplasia, prostatic cancer, all these things with testosterone makes the prostate, just like the humans,
I never
get
heard
bigger.
of that before.
But dogs get the same disease that humans do.
Really?
And granted, we don't castrate humans, which I'm not getting there. But and you get the human males. I'm not going to castrate my male dog because they anthropomorphize them onto us, and we just had that the other day. Well, I'd like to get neutered, but my husband, he's a guy. He doesn't want to take away the manlyhood of his dog. Down the road, I get enough of those dogs, and quite a few of those intact male dogs, blood in the urine, big prostate, and then now the cure is, guess what? To castrate them. And that takes that prostatic hyperplasia, the blood in the urine, the straining, and the discomfort and pain down the road, where if it was done younger, you could have prevented some of those behaviors and that disease to begin with. So those things we don't think about, and that's why Dr. Dan is here to help you think about those things with your young pets that you have out there right now. So keep those in consideration when you're getting a new pet.
What does it cost, Doc? Just in general, if you have a normal, nothing goes wrong type of, let's say, castration.
Good. And I don't know the exact numbers. I can give you a range. A normal, 20 to 30 pound dog, probably for a castration, you're probably talking $200 to $300, and a female dog $300 to $400, and maybe even a little less or a little more. It depends. Again, Riverside Animal Hospital, we're the laser surgery center, so our laser adds a little bit of fee to that. We certainly recommend blood work. We don't require it on every young animal. Once they get 2 years old, we require that blood work to make sure they're healthy for anesthesia.
Sure.
There's pain medications, there's fluids, there's a few things that we highly recommend. But unfortunately, in this competitive world of veterinarian practices, there's a lot of them out there that don't offer laser, don't offer blood work, don't offer pain meds, and they have a really low number, like just that lower end 200, which is kind of the bare bones. So and that's a good question. I'm glad you asked that. So when you call to ask around, hey, what does it cost to get your dog neutered? Really, people out there listening, keep in mind, it depends what you want. You want the bare bones and hope that it isn't in pain, doesn't have complications, doesn't have a bleeding disorder, doesn't have
What's the
things.
benefit, Doc, to the laser versus a knife?
And we talked about that for the radio, and I'm glad you brought that up. I've been doing the laser surgery since 2000. In fact, I maybe once a year somebody declines the laser. It is easier on the dog as far as it seals the nerve endings so they don't feel the pain.
So it literally cauterizes it as you're cutting?
Not only the blood vessels, but the nerves too, which is pretty amazing. Like the D-claws, which I won't get time today. These cats are walking around on their paws right afterwards. They don't feel the pain like if a scalpel does, where you cut yourself. It has a stinging sensation if you ever poked yourself or cut yourself, and it throbs for a while, just that cutting the nerve endings. Well, laser seals those, so you don't feel that. And I've, on a rare occasion, zapped myself, and then you feel the zap, and then it's gone. There's nothing left. It's like, oh, you don't realize, and you just keep on going.
Right.
And that's what the laser does. Also, because it seals the nerve endings and the blood vessels, it gives you cleaner field of vision. Spays, neuters, especially older dogs with a big scrotum, it seals all those little vessels in there, so you don't have bleeding afterwards, which is a big part.
So do you just glue that back together, or do you stitch it?
I do stitch. I do stitch, but I'm very careful with the type of suture I use so it doesn't poke more blood vessels, and it works very well. And it's interesting for me as Dr. Dan doing the laser at my clinic, Riverside Animal Hospital, and then many people already know I also teach surgery at the Vet Tech program where we use the scalpel.
Right.
The night and day between, oh my God, there's blood everywhere, and then they're oozing afterwards, and sometimes they have little hematomas and such, and you just don't have that with laser, and they don't have a little bit of that complication. It's not a life-threatening complication. It's a morbidity, so they just heal faster instead of mortality. They don't die from either one of them, but you have less oozing, less licking, and less complications like
what
that.
What do you do to knock them out? What's that method?
Just like you humans, we pre-med them with some good. And that's what we're talking about extra expense. We give them a payment injection first,
Okay.
and then we give them a sedative to relax them. We induce them with the same white stuff that we use in humans. If you've ever been anesthetized, that propofol,
Okay.
which has been made famous with Michael Jackson and a few people.
Mhm.
It's a great pre-anesthetic and knocks them down. Then we intubate them, which again, that's an expense that some cheap places don't do. They don't intubate them. They just stick a mask on them, do the surgery, pull the mask off, and it saves them money. They charge you less. Unfortunately, you don't know that as a consumer. How was my dog anesthetized?
So let's talk about that too. So what is the intubation where you put kind of a tube down the
Yep,
throat?
just like humans. You
What's
see it on
the
the
benefit to that versus just a mask?
What if
with
they
the
vomit?
stuff in? Okay.
If they vomit during surgery or salivate excessively, it goes down to the lung and protects that
okay.
airway. So if they, in a rare instance, they would potentially vomit. Maybe they just had extra fluid in their mouth, and now that went down into their into their lungs and caused pneumonia afterwards.
I got
You don't have that problem.
Okay.
And so that's the benefit and the expense and the precautions we have with intubating. And we intubate every single surgery at Riverside Animal Hospital, except for just cat neuters, because they're so quick and we get them up right away. But any of the procedures, we do intubate everything down there. And again, that's built into our cost, which is going to be more expensive than some of your cheap clinics that don't do that. So,
Okay.
so I would, in the back of your mind, consumers out there,
about all
be
this,
thinking,
yeah.
hey, they're way cheaper than you. I wonder why it is. It isn't that like some of the clinics like Riverside are expensive. We're doing things right to make
Right.
it safe, comfortable, better outcomes. And I'll tell you, knock on wood, we have an amazing record at Riverside Animal Hospital as far as complications. I know some of the other less expensive places, they have a lot more complications because they don't have the workups and precautions. And great questions as far as the spay and neuter, things to ask. So when you ask them the prices, and like at Riverside,
it's more than just the number. Get into the details, like
Exactly.
we're digging into the details.
what are we getting?
here.
Some blood work, some safety. You know, we have a heated table at Riverside Animal Hospital. We have a certified technicians doing anesthesia. That's an important part. So they know how to monitor, and I'm so proud of my technicians at Riverside. I mean, they're trained as anesthetists, not just a layperson off the street. You know, do you have a certified technician monitoring your anesthesia? We do. Not all places do. The less expensive places, I guarantee you, don't.
Right.
Yeah, because we have to pay them more to do that, and we have more equipment, more monitors, checking their heartbeat, checking their oxygen, checking their blood pressure, all that stuff.
Well, everybody loves their animal, and if you truly love your animal, you'll take them to Riverside because of all the things that we've just
Yeah,
discussed. I mean,
we're willing to answer everything. If you have questions on how we do that, we'll even show you the surgery room. We're very proud of our facilities and we even do therapy laser to help them heal afterwards. So a different kind of laser for healing. So we do a lot of different things. I appreciate your time. Questions, awesome. And if you have any more questions, 264-0761, or look at our website at riversidevet.com. My shameful plugs. And we'll see you in 2 weeks.
all right, yeah, we kind of ran over, but it was
Well, we got
fun.
started a little late.
We got a lot of good questions answered here.
You
so,
betcha.
Yeah.
Thank you very much.
All right,
Until
Doc.
next time.
Thank you so much. Take care, and take care of that guitar, will you?
All
All
right.
right. That's another one to go on the greatest hits album there from Dr. Dan, the Animal Man. This is KWPC. We are the voice of Muscatine.